My name is Terry. I was diagnosed in 2015 March with stage 3/4 squamous cell carcinoma of the larynx, specifically of the false vocal cords. If I were to say anything to anyone about having head and neck cancer, and for me a laryngectomy it is life-altering, no doubt, but it's not life-ending. The first part is so overwhelming. There was 91 days in the hospital, largely in ICU. Nothing, of course, by mouth, no food or water, about a fed tube. So it wasn't, and I was aphonetic, meaning I couldn't speak because they'd done the puncture for the transesophageal valve, but it was a fresh wound, so it was not to be disturbed, so there was no talking. I communicated to caregivers, my wife and kids, using what's called a boogie board. It's just a board you ride on and push a button and it erases. So for 3 months, I really wasn't worried about the side effects of being a laryngectomy. It was more like, how can I get by to something to eat or drink water? So then after that, it was, through really baby steps. Drops of water, sometimes a few ice chips in a day. And of course, you're laying in bed, the only thing to do is watch TV. Every commercial was about food or beverage. It seemed like I was ready to eat boiled liver if I could just get us something to eat. It was that's probably one of the most mentally challenging things was I'm a very oral guy, and really, so when eating came back, that was a big day, and every day was just more and more steps till I was finally able to go home, and it just kept getting a little bit better all the time, and finally I could see a light at the end of the tunnel that said I was going to be able to function reasonably well. I wasn't going to sing anymore. I wasn't going to be able to do funny accents anymore. But I could stand, I could talk, I could breathe, I could help other people. So it's a journey for sure. I had an amazing surgeon, and by far, my wife, Jennifer, was an astounding brick. She went to the mat with insurance agents and insurance companies, fighting for everything. My daughters all came. They were amazing. The home health aides that came every time that the insurance companies would allow were all astounding. So we had a lot of help. But the day-to-day things, I was still pretty useless. So Jennifer, while working full-time, would get up and feed me through my peg tube every 4 hours, change dressings, including, packing fistulas and doing things that are normally done by medical professionals. But she stood up and became strong and did everything. You can blow your nose. It's not connected anymore. First time I sneezed, I held my tissue up here. I chewed. I That's not where it comes out anymore. Some of the things that came up in terms of cost of care that were hurdles or things that the insurance company didn't want to cover. For example, that little shower cap that I mentioned, these holders are disposable. I use one or two a day. They wanted you to use a tracheotomy one that is reusable. Well, with the laryngectomy, it's messy, and you need to have the ability to change these tracheotomy holders. It's a challenge to convince the insurance companies that that's necessary. Social Security, Medicare, again, we're kind of a rare breed, and it takes someone to explain to them why I need more than 2 tubes a month, why I need more than 1 filter a day. This filter helps me stay, keep humidity, it's called an HME, heat, moisture exchange, heat, moisture exchange. If I cough and it gets wet, it's useless. I have to throw it away. Then once my 2 for the day were used, I had to go sit in the humidity instead of being able to be mobile. That's those kind of things that you wouldn't normally think that you have to think about are expensive. Luckily for me, I spent 8 years in the military, in both the Navy and the United States Marine Corps as a medic. And some of the caustic factors were found to be caused during my time in the military. And most recently, I was determined to be 100% medically disabled from the military. So the VA has been helpful as we navigate the field of getting the supplies that we need for a laryngectomy to basically stay alive and function. So sometimes it's Medicare, sometimes it's insurance, sometimes it's the VA, sometimes I go to Fort Leavenworth. But with the help of my lovely wife, that I mentioned how spectacular she is, I get what I need. And I try to help other people. I'm online with laryngectomy support groups. I go to laryngectomy meetings that I can go to in and around Kansas City. I'm very active in one here in our town. People, laryngectomies or caregivers to laryngectomies. There's a lot of Q&A, and I try to be as proactive in that as I possibly can be, including go to the hospital to see laryngectomy patients before or after an operation. And that's not hard. I'm reminded I laid in an ICU bed without a drop of water, and I'm so happy to be able to tell that man or woman it gets better.